This podcast, simple summary of a scientific peer-reviewed paper, is made with the help of AI by Big Head Pain, Dr. Faraidoon Haghdoost. Today's episode covers the paper, Real-World Use of Over-the-Counter Medications by Patients with Migraine in Japan. Results from the Overcome Japan second study by Ryotaro Ishii et al., published in the Journal of Headache and Pain in May 2025. Why do so many people with migraine in Japan turn to over-the-counter drugs instead of prescription treatment? That's the question at the heart of this study, a large-scale online survey called Overcome Japan Second, which included nearly 20,000 adults living with migraine. And the answers reveal a combination of convenience, misunderstanding, and missed medical opportunities. The researchers found that more than 70% of people with migraine used over-the-counter medications in the past year, whether or not they had seen a doctor. Among those who did consult a doctor, over half still reported using over-the-counter painkillers just as much or even more than their prescribed medications. Surprisingly, this pattern was strongest in people with relatively few migraine days per month. But even in people with frequent or chronic migraine, over-the-counter drug use remained high. Only a small proportion used migraine-specific treatments like triptans or CGRP monoclonal antibodies. In fact, around 65 to 90% had never even heard of these options. Why the heavy reliance on over-the-counter medications? Many patients believed they could manage migraine themselves, or that prescription medications wouldn't be any better than what they were already using. Others hesitated to see a doctor because they thought migraine wasn't serious or didn't know where to go. A cultural emphasis on perseverance and self-reliance, known as gaman in Japan, may also play a role. This approach has risks. Nearly 30% of patients who used over-the-counter drugs on 10 or more days per month showed signs of medication overuse headache, a condition caused by taking too much pain medication. And because only 14.6% had discussed their over-the-counter use with their doctor, many healthcare providers may be unaware that patients are mixing treatment types in ways that could backfire. The study ends with a clear call to action. Doctors should routinely ask about over-the-counter drug use, provide education about the risks of overuse, and help patients access appropriate treatments, including newer options like CGRP monoclonal antibodies when necessary. Education is essential, not just for patients, but for general practitioners too, who may not always be aware of the latest migraine-specific treatments. This study shines a spotlight on an overlooked issue in migraine care, one that's deeply relevant, not just in Japan, but worldwide.